Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Amita Kundra. She is a cardiac anesthesiologist, and she wrote the Kevin MD article, How Technology is a Weapon in the Fight Against COVID-19. Amita, welcome to the show.
Thank you for having me today.
We'll get into your article in a little bit, but first off,
Sure.
can you share your story and your journey to where you are today?
Sure. So I'm a practicing anesthesiologist. I've been practicing for about 7 years now. I grew up in Connecticut, trained and went to college in New York, and then went to medical school at Ross University. And then, I wanted to do anesthesia. I ended up matching in Buffalo, New York, and I ended up doing my fellowship in Buffalo as well. And now I'm practicing in the New York area. So it's been a long journey, but I feel super grateful.
So from an anesthesiology standpoint, we're talking in the third week of January. What are you seeing from a pandemic standpoint?
We're seeing our numbers climbing. In New York, we really faced a lot of challenges in the spring. We really had a peak at that point. Our hospitals were flooded. So, we're slowly seeing an increasing rise in our hospitals, but not nearly as high as we had in the spring. We're taking precautions. Fortunately, we do have the vaccine that's being rolled out. So we are getting patients and healthcare workers vaccinated as quickly as we can. But, it's definitely it's definitely stressful now to be a healthcare provider. And we definitely feel the stress all around us. I mean, we're stressed, and the patients are struggling as well. Their families while they're in the hospital, but we're doing our best.
Wonderful. So let's go ahead and transition into the Kevin MD article that you wrote, How Technology is a Weapon in the Fight Against COVID-19. Now, for those who didn't read that article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, so I've always had an interest in healthcare technology. I'm an advisor to several companies, and actually during the pandemic, I was on bed rest. I was 33 weeks pregnant, and so I was part of a group that was working on developing technology for the COVID pandemic. I developed a symptomology tracker with a group of people internationally to help, patients in developing countries just triage them at home so that we were able to determine whether they needed to come into the hospital or whether they'd be able to be managed at home. So during that time, I started seeing a lot of technology that was coming out internationally, from technology related to contact tracing, from the Blue Dot, which was monitoring the pandemic, using data science. There was just amazing technology that's been coming out. I mean, just telemedicine in itself has really been the top, just in a short period of time, and it's been around for such a long period of time. So I really explored what technology is out there. There's a lot of AI technology that was being used by radiologists to assess whether the patient may have signs of COVID pneumonia. And so I just wanted to explore what's out there. And I also think it's important for physicians to become involved in any way in the development of technology or the assessment of technology, because we're really the ones who are using it. So that's why I wrote the article, and that was kind of the synopsis behind it.
So you mentioned telemedicine, and I'm a primary care physician myself, and of course telemedicine has grown by leaps and bounds during the pandemic. You mentioned some other technology regarding contact tracing and what radiologists use. What piece of technology do you think has gained the biggest traction other than telemedicine during the pandemic?
I would say really the technology behind the vaccine development. And I think that there's so much that was, whether it's the mRNA technology, whether it was a technology of distribution, there was a lot of work that happened and a lot of innovation that happened just to get to this point. And I would say that's probably one of the biggest accomplishments that science has made in many years. And apart from that, there's a lot that's out there. Unfortunately, a lot of it wasn't utilized in the United States as much as I wish we could have. For example, there were robots that were able to disinfect and clean rooms and bring COVID patients like, supplies or food. I mean, there's a lot there, but a lot of it couldn't be utilized. I mean, there's so many restrictions such as cost, availability, just the administrative hurdles that a hospital faces in terms of approving these devices. It's impressive to see, but there's a lot that has prevented us from getting to the point where we can actually utilize it.
So you alluded to some other countries are using technology more frequently and it's
Yeah.
more readily available than we are in the States. So what other countries are we talking about?
I mean, if you look at China, the contact tracing technology that they were using was phenomenal. You would scan your phone at a train station and they would tell you where you are, and also would be able to connect you with the people that you have been in contact with in the past day. Google and Apple had this technology that they have developed, but in the United States, we're a little reluctant due to privacy issues, and understandable, but at the same time, Google and Apple are tracking where we are at all times anyways. So there were kind of some hurdles in terms of adapting these technologies into the United States.
So what do you see is the future of, say, contact tracing? Because like you said, I think there's also some cultural differences, because if you look at countries in the Far East, like China and Korea and Taiwan, I think there's a different emphasis on privacy and a different acceptance on part of the public when it comes to privacy. Like a lot of the public over there don't mind if their locations are always tracked by the government, but I don't think that's probably going to fly here. So I guess what do you see are some of in the immediate future, the future of these contact tracing apps in the United States?
I mean, it's really hard to say because you really have to get the public to buy the idea. And, we had a discussion about this recently on Clubhouse, which is like this new app that I started using. Another thing that the COVID pandemic has given us. Have you used Clubhouse at all? It's
I haven't. I have heard about it on my various physician Facebook groups, but that's something definitely on the list I'm going to try.
Yeah, you should definitely try it. And I'd love to have you in one of our groups. But yeah, so we were talking about just how the United States and how we are just not really, we're not really willing to buy the idea of someone invading our privacy and knowing where we are at all times, even though it's already there in many formats. So I don't know if there's a future for us in terms of contact tracing unless the government mandates it, or there's like a really big public-private partnership that takes place that really gives the public a little more reassurance about their privacy. But, I'm hopeful for the future, and I'm hoping that maybe we'll be able to develop something.
Now, what do you foresee as some of the immediate technological advances that may come online in the near future?
Okay, in terms of vaccine development, there's been a lot of treatments that are coming out, not only the vaccine itself and the technology, but also in terms of treatment. So there was a friend of mine, his name's Dr. Reed Rubson, and he's developing T-cell immunotherapy to treat asymptomatic patients who are positive. And the theory behind that is to just reduce transmission of the virus to people who may be immunocompromised or may be at higher risk of mortality. So I think that I think that's in the pipeline. He's doing clinical trials in Ohio, and he's been trying to do clinical trials, and he has a lot of support. So I think we'll be seeing that in the future. I also think we'll be seeing more technology behind just distribution of the vaccine. There's a lot of partnerships that are taking place, like North Carolina, CEO of Honeywell, the owner of the Panthers, their work, and I think another CEO of another company, they've all come together. They're working with the North Carolina government to distribute the vaccine. And, there's a lot of issues associated with vaccine distribution, like, we have to get to populations that, like socioeconomic populations of people that may not have rides to the site. They may not have a car, so we need to provide them transportation. We need to establish portals that are easier to use for the elderly to sign up for the vaccine. We need to have portals that are reminding patients that, okay, you need to take your second dose on this date. And I think there's a lot of people that are working hard to do that. The third thing is actually sanitation, and there's people that are developing air filtration systems. One of my friends, he's actually working on a great one, and it's basically helping filter air particles in the air, in the theory that it will reduce the transmission of COVID-19 in the air. So there's a lot coming, and I think we'll be seeing it in the near future.
We're talking to Amita Kundra. She is a cardiac anesthesiologist, and she wrote the Kevin MD article, How Technology is a Weapon in the Fight Against COVID-19. Amita, you mentioned that physicians need to get involved with these technology companies going forward so they could be better adapted to what we can use, and you yourself are involved with a couple of technology companies. Tell us about how you started with that, and how did you get involved with these companies?
A lot of it is networking. I started attending a lot of events in New York City. There's a lot of accelerator programs that are looking for physicians to give their input on technologies that are being developed in healthcare. So a lot of it's word of mouth. I've been reaching out to different companies that I feel that are of interest to me. The social media has really brought people together, and through my social media account, a lot of people have approached me and asked me to give their advice about a project that they're working on or something that they're developing. So it's been fun. It's kind of a way for me to fight burnout, because it really allows me to see what's coming in the future. Medicine is ripe for disruption. I mean, there's a lot of problems that we face every day, and I think there's so many ways that technology can help us. And also, like I mentioned before, many times we're the last to know about this technology. We'll be taking care of a patient and suddenly we're told, oh, this is a new thing that you need to use to do this procedure. Many times it's a technology that I don't really understand how it works, or I don't think it's truly effective. So I really want physicians to get involved in any way that they can. And I really hope that we can encourage the next generation to, innovate, to work with individuals that may be able to help you develop a solution, because I think we're the people that are actually utilizing it the most. And if we don't get involved, it'll just be placed upon us.
And do physicians need any special training before they start working or advising technology companies?
I don't think so. I think that our experience that we have clinically is valuable to these people, because a lot of these people are biomedical engineers. They're in business, they're in finance, so they have a different perspective than we do. So, there's really no course. I do take courses that are of interest to me. So I think it's important, to never stop learning, to keep advancing yourself. So that is important, but I don't think it's necessary to get any training to take that first step. Just jump right in.
And what's your take-home message you want to leave with the Kevin MD audience?
I would just say that never stop learning and never give up, and never be afraid to ask a question, to reach out to someone. Now it's actually a little easier than it was before. We have Zoom meetings, there's places like Clubhouse, there's social media where you can connect and network with people. So never be afraid to reach out to that person, because I feel like it's so important that we just get involved and jump right in there at times. Sometimes we're afraid.
And how can people reach you?
So I actually have a YouTube channel that I've launched. It's Amita Kundra, MD. You can find me on YouTube. I'll be interviewing CEOs and founders in healthcare. I'll also be trying out new wearable devices and new things that I feel enhance my daily life. I have an Instagram account, Amita Kundra, MD, and you can also find me on Twitter at Ask Amita. So it's fun. Thank you for having me.
Well, thanks again for sharing your time and insight, and thanks again for being on the show.
All right. Thank you so much.